Most people regret their Medicare decision because they didn't understand what the rules are in order to change plans in the future. So in this video, let's get really clear on what these rules are so that you can avoid the same mistake that too many people make and be very happy with your Medicare decision both now and in the future. Again, I'm Emily with the Medicare Coach. We're the leading independent Medicare advocate, helping you easily navigate the confusion of the insurance companies and all the government rules to protect both your healthcare rights as well as your retirement savings. You've worked hard for Medicare. Let's now get the most out of it. Make sure that you like this video and subscribe to our channel to get more insider tips to get the most out of your Medicare benefits. So when it comes to Medicare, there's a lot of misunderstanding about what the options are, what the rules are in order to change Medicare plans in the future. Most of us have heard on the news about, guarantee issuance rights underneath the Affordable Care Act. And so we assume that all health insurance plans kind of have this ability to be required, that requires insurance companies to accept you no matter what your health situation is. But the reality is Medicare is different and does not actually abide to those rules. So again, let's go in detail about what the Medicare rules are to be able to change plans in the future so that you understand how the world works to avoid surprises going forward, okay? So Medicare rules, or Medicare has what's called guarantee issuance rights, specifically around their Medigap, which is also called a supplement plan, okay? So Medicare rules say that when you first join Medicare, you have a 6-month window where you are automatically insurable and every single company is required to accept you no matter what your health history is. But once that 6-month window expires, if you try to join a new supplement company, whether it's a new letter or a new provider, they can ask you for your health history and they can deny you coverage if they don't like what they see or they don't want to cover you for any reason. And this rule is why it's hard, if not impossible, to switch plans in the future. Most people want to have a Medigap plan, also called a supplement plan, when they have health issues. But the reality is, again, these plans have these guarantee issuance rights, which can make it hard, if not impossible, to switch plans in the future, okay? So let's get really clear on that. Now, again, I cover this in other videos, but there's other parts to Medicare as well, right? There's Medicare Advantage plans as well as Part D drug plans. And both of those, both Advantage as well as Part D plans, you can change every single year. And you usually change those plans during Medicare's Open Enrollment period, which goes from October 15th through December 7th. So all of those plans have to accept you, no matter what your health history is, as long as you apply to a new plan during an approved period, okay? But again, the issue is that these Medigap, also called supplement plans, have unique rules where they are not required to accept you if you apply for a plan outside of that 6-month guarantee issuance window, okay? So I mean, that's kind of the overarching rule when it comes to the US, when it comes to how these Medigap and these insurability rules work. Most people don't realize that they don't have this option to make the change later on, which again can lead to issues. Most people do not realize that they're in the wrong plan until they're sick. And once you are sick, again, it's usually too late to get that Medigap or that Medicare or Medicare supplement plan. Okay. Now, with that said, Medicare is complicated and there are a lot of rules out there. And there is one rule specifically toward this guarantee issuance right for Medigap plans, depending on the state that you live in. Okay. So for example, in New York State, you are automatically allowed to join any supplement plan, any Medigap plan that you want, no matter what your health history is. Now, this does come at a price, right? New York does tend to have more expensive Medigap plans than any other state for this reason, but there is a strategy around that we have to save you money as well. So if you're in New York State, you can do whatever you want, okay? You can switch whenever you want. Washington State has not the same rule, but they have a different rule that basically says if you join a Medigap plan when you first join Medicare, and if you join through certain letters, then you can switch between those letters at any point in time, no matter what your health history is. So it doesn't give you that full ability to go between Medicare Advantage and supplement like New York does, but Washington State does have that unique rule that you can change between letters no matter what your health history is. Now, there are other states like California or Missouri that have a few months in the year that you can move to an equal or lesser supplement plan or to the same supplement letter at a different company during a certain period of time, whether it's on your birthday or whether on an anniversary. So my point is this, Medicare is complicated. You should assume that your state has standardized insurability rules unless someone confirms with you that you're like a New York state or a Washington state that does have some more relaxed options. But too many people go into Medicare picking a plan that's right for them now, not realizing that the plan that they pick when they first join Medicare could be the one they have for the rest of their life. So please get Medicare right when you first join Medicare. Be thoughtful, know the rules to again protect both your healthcare rights as well as your retirement savings. All right. I've included some extra resources down below to again make your life easier when it comes to Medicare. So check those out. Also make sure that you like and subscribe to our channel to get more insider Medicare tips to make your life easy. Here's to helping you easily make your right Medicare decision and getting the most out of your benefits.